Hi everyone, this is Emma. This is my case study presentation for my adult practicum. I am currently doing my adult practicum at Ozanam Hall of Queens. It's a skilled nursing facility. It is an inpatient facility. Some of the residents are short-term and get discharged back into the community, and some are long-term. They remain there for as long as they want. Okay, so I will be presenting on my client. She was one of my first clients when I started at Ozanam. I will refer to her as AP, as those are her initials. AP is a 93-year-old female who came to Ozanam Hall on August 18th, 2016. This was following a hospitalization for a left temporal parietal lobe infarction that occurred on August 14th, 2016. Hospital CT scans were the assessments that were given to AP, and they revealed chronic microvascular ischemic changes. Following admissions to Ozanam, AP was evaluated on the 18th using an basic oral motor examination. No significant neuromuscular weakness was noted. She had generalized weakness, but nothing too severe that we needed to address. She was also administered the bedside swallowing examination, a variety of modified language and cognition assessments. So following her assessment, which showed that she presented with mild to moderate communication impairment, which was characterized by impairments in receptive and expressive language, associated cognitive linguistic skills, as well as overall speech intelligibility, and also mild impairment for auditory comprehension. We decided that AP was a great candidate for speech therapy, seeing as she also presented with apraxia of speech and anomia related to aphasia. These findings allowed us to refer her for speech and language therapy 5 times a week for 8 weeks. She also received physical and occupational therapy during her time at Ozanam. So this is just a little medical history about AP. This CVA was not her first. So as stated, she had a previous myocardial infarction, vitamin nutritional deficiency, generalized muscle weakness, and aphasia following a cerebral infarction. So currently, she was admitted with the diagnosis of cerebral infarction due to embolus of unspecified cerebral artery, hypertension, hyperlipidemia, muscle weakness, slight dysphagia and anarthria, vitamin deficiency, atherosclerosis heart disease, angina pectoris, and as I stated before, apraxia and anomia. Okay, so although the client comes in with all of these diagnoses, we evaluate and choose which are most important for our therapy plan. We noted that she presented with aphasia following cerebral infarct, resulting in anomia, which we know as a difficulty retrieving words. She also presented with apraxia of speech. So while she didn't have significant neuromuscular weakness, apraxia wasn't in relation to that. So it's in relation to messages from the brain to the mouth that are being disrupted. So her speech was unintelligible. The severity of the disorder depends on the nature and severity of the damage to the brain. And like I said, we decided that she was also presenting with dysarthria and anarthria and slight muscle weakness. Okay. Based on what we saw during the assessment, we created these short-term goals for AP. The first one being that we would work on increasing naming of functional objects to 60% accuracy with maximum cues. So, for example, we would present her with picture cards that contain functional daily objects such as fruits, vegetables, household items. Once presented with the picture card, the clinician would verbally cue the client by saying, "What do you see here?" or "What is this?" or "Can you tell me what's on the card?" As time went on, need for any type of verbal cue decreased as the client got more familiar with the cards. She began to automatically name the object on the card when presented with it. She would say things like, automatically, like, "That's an apple," "That's a lamp." Okay, so we also wanted to work on increasing identification of functional objects. So that means that we would present her with multiple cards and ask her to identify one of them. So maybe we would present her with 3 cards, an apple, a banana, and an orange, and ask her to point to or pick up the banana. This also worked on one-step directions. We typically tried to work on more than one goal at one time. We also wanted to increase verbal formulation / ease of length of utterances. We wanted to increase ease of production for functional words and increase auditory comprehension for one-step directions at first, which we then increased to 2-step directions. During our assessment, we found that AP exhibited slight difficulty with 1 to 2-step directions. She made a lot of progress from this short-term goal. We worked on it through a lot of our other goals throughout the sessions. Okay. So these long-term goals might seem a little general, but I just want to state that they are very appropriate for AP. The purpose of our therapy with her post-CVA was to increase her daily functional communication skills. So, as I stated before, she presents with expressive and receptive language impairments. So that's why we wanted to increase her overall speech intelligibility, receptive, and expressive language skills. This was really important so that she's not only able to express her wants and needs throughout her stay at Ozanam Hall, but also so that she can interact with the staff and other residents, and also so that she can interact with her family when they come to visit her. AP's family came to visit her frequently, and it was really important for them that they're able to talk to her and, interact with people that she's met at Ozanam, and they want her to be able to tell them about it. So increasing functional, reliable communication was very important also. Right. So for AP's daily therapy, we started out working on naming of functional daily objects using picture cards like I talked about, following simple one-step directions, increasing verbal formulation, and then we wanted to change her therapy a little bit. We noticed that after a few weeks, her progress began to plateau. So while she did make linear gains, in the beginning, they were significant. After a few weeks, they began to be just slightly gradual, nothing too significant. So we wanted to switch up therapy a little bit, and we did a lot of research. So because AP presented with anomia, which is an inability to retrieve words, and it affected her at the word, sentence, and discourse level, we wanted to find a way to increase her ability for her to increase linguistic organization. And we did this through verb network strengthening treatment. VNEST improves systematic retrieval of verbs and their thematic roles. So this therapy is basically increasing linguistic organization for 3-part segmented functional activities using a visual anchor. So we began working on strengthening her verb networks in the hopes that it would expand speech production and carry over outside of speech therapy and outside of the typically trained noun therapy. So VNEST has been proven to help patients presenting with anomia. Like I said, it can affect language on the word, sentence, and discourse level. most of the lexical retrieval therapies that we've researched worked on word-noun production, single word production, which it has been proven to increase the client's ability to retrieve semantically related nouns, but has not been proven as much to generalize to sentences or discourse. So through VNest with AP, we started at the bottom in terms of difficulty and amount of cues. So VNest therapy typically starts out with presenting the client with a verb, which is also known as a measure, and they're asked to retrieve related agents or doers of the action, and patients, which are receivers of the action. We tried to facilitate that with AP. We found that in the beginning it was a little too difficult for her, so we had to scale back a little bit. We ended up providing her with the doer and the patient and asking her to provide us with the measure or the verb. So we would present her with things like the doer pilot and the what of a plane, and we wanted to facilitate her use of the word flies or get her to fill in the verb. So through our research, we found that participants of VNest therapy typically end up generating multiple pairs of agents and patients per verb. So that they do this by eliciting various event schemas. So the verbs help to expand retrieval of other words. So over the next few weeks doing VNest therapy, AP continued to make gradual linear gains. Over the entire 8 weeks, she made significant gains from when she was first admitted. But especially after we modified our therapy approach, she just seems like she just came to life. Her spontaneous speech was increasing, and she felt more confident in what she was saying. She talked just a lot more, and her intelligibility increased a lot. So as you can see, I put that she achieved 90% accuracy for naming of functional objects, 80% accuracy for verbal formulation, 90% accuracy for ease of production for functional words. All of these were providing maximum verbal cues, such as like repetitions, imitations, and then the 55% accuracy for linguistic organization for the 3-part segmented functional activities was via the VNest therapy, which we didn't implement until halfway through therapy. So AP was discharged from speech therapy, and she was also moved to a higher, more cognitively advanced floor where she could interact better with the other residents. And she was now able to eat lunch in the main dining hall. She didn't need to eat on her floor anymore. And we noticed that once she switched floors, again, her speech began to increase. Her intelligibility was increasing. She was talking more. So rather than being discharged from therapy, all 3 forms of therapy, speech, occupational, and physical, and going back out into the community, AP and her family decided that it would be best if she became a permanent resident at Ozanam Hall, and she's doing great. We get to frequently follow up with her and track how she's doing. She continues to practice VNest therapy on her own. We provide her with worksheets every so often, and when she completes them, she'll come to get more. AP was a great client to work with. I learned a lot from VNest therapy, and I would definitely recommend it to anyone who has a client presenting with anomia. And overall, it was a great experience. I loved my placement at Ozanam Hall. And these are my references where I got my information about AP's characteristics and her disorders, and where I got my information about the VNest therapy. Hope everyone had a great end of the semester.